Hi, my name is Nicole Mason. I'm a psychiatric PA. I've been in clinical practice since 2005. I have a Doctor of Medical Sciences degree from the University of Lynchburg, and I'm currently NCCPA certified in both psychiatry and general medicine. So with all that experience, that gives me some background into billing, which is going to be our discussion today. We're going to talk about what happens when you, the patient, are seen and how eventually you're billed and what happens with that bill. So when you are a patient and you go into a medical practice, whether it's a behavioral health practice or a surgical center or primary care office, with few exceptions, the general office visit is about the same. At the end of your visit, you check out, and depending on what the contract your insurance company has with you, you will either pay a copay, co-insurance, or nothing on that visit. And so at the end of that visit, what happens with your provider is that they enter a diagnosis, which is also known as an ICD-10 code. And so that diagnosis or ICD-10 code is submitted into your chart, as well as what's called a CPT code. A CPT code is basically the level of care that you were provided for that day, and that has along with it a monetary sum associated with it. And then usually from there, it's handed off to the biller. And so what the biller will typically do is extract that ICD-10 code as well as that diagnosis code from the visit that you had with your provider. It's also called an encounter or a note. So they extract that information and usually that electronic note from your provider and submit it on something called a claim. And I'm going to share with you real quickly here a picture of what a claim will look like. So typically when your biller will extract information, it will go onto something that looks similar to this electronically. And so as you can see here, you've got the patient information. If there's any patient insurance information, it goes right here. Here are your diagnoses that go along with it. Typically, it's just the first 4 or 5 that insurances will actually look at, though, when they're contemplating whether or not they receive the care that they feel that you met your provider met the criteria for the care that you received that day. And then down here, you have what are called your CPT codes. So right here, typically the office visit will be the first line, and then anything after that comes after that. So like in this case, it would have been a urine drug screen. If it's a lab draw, an injection, something like that may go after it. Sometimes there's modifiers put on these, and the modifier depends on what was done that day. But typically, the biller will extract this information. From there, the biller will then scrub it, meaning that they'll do a test run to see if they have pulled all of the correct information from you, the patient, as well as the provider's note. And if the answer is yes, then it's sent off in what's called an electronic claim and submitted to the insurance company. And so that process works a lot like the USPS mail system. All right, it goes to a central clearinghouse, and then from there is sorted and sent on to the specific insurance company. Sometimes it can be sent to other centers like Availity before. So first go to Optum and then Availity and then on to the insurance company. Sometimes it'll go depending on who your provider uses as their clearinghouse. It could go straight to Availity and then to the insurance, or it could go straight to Optum and then to the insurance. But at any rate, it works similar to the post office, where it goes to a main hub, it's sorted and then sent from there. At that time, then your insurance gets it and they look at that ICD-10 code and they correlate it to that CPT code and decide whether or not that level of billing meets the diagnoses that you received that day. If the answer is yes, then based on the contract now that the insurance company has with the provider. So again, remember, when you checked out, whatever you paid for, whether it was the copay or co-insurance or nothing, depended on the contract that your insurance has with you. Now, at this point, though, in the billing process, the amount that the insurance will pay for that to the provider depends on the contract that the insurance has with the provider. And so from there, they will either pay the whole bill or they will do what's called a contractual adjustment, where they will say, no, we're not paying that much. We've contracted to only pay X amount with you for this procedural code. And so they'll knock off some of that. And then from there, they'll say, okay, so this is the maximum amount that we've been contracted with your practice to pay for you. And of that amount, with our contract with the patient owes this portion of the bill, if anything. So sometimes they may pay the whole thing. Sometimes they may pay nothing. Say you haven't met your deductible yet. Sometimes you will pay a portion. Say if your co-insurance is 80/20, then the insurance company, after you've met your deductible, would pay 80%, and you, the patient, would pay 20%. This is probably a good time to also talk about some terminology, copay. So copay is the amount that your insurance company has contracted with you, the patient, to pay at the time of visit. So usually that's somewhere between $10 and $50. Contrast that to co-insurance. Co-insurance means that you are both working to pay for that visit. So with co-insurance, it's usually an 80/20 until you've met max deductibles. So it can be different though. It can be 50/50, and then out of network can be like 20/80 or 50/50 or nothing at all. It depends on the contract that you and your insurance company have. But the most typical one is going to be an 80/20 co-insurance. Deductible. Deductible means that's the amount that you, the patient, have agreed to pay before your insurance will take over. And so what that means is that if the provider, say me, sends a claim to your insurance looks at that and then again says, well, we have contracted to only pay this amount, not the amount that you have sent in for us to pay. So we're going to knock off, the overage amount. And then they come to you, the patient, and say, well, you haven't met your deductible yet. You haven't met that minimum threshold yet. So you're now responsible to pay all of this. Well, once that deductible has been met, and that can depend, for some insurances, it can be $500 deductible. For a high deductible insurance or an HSA plan, it can be $5,000. But whatever your deductible is, basically, your insurance knocks off a portion of the note of the encounter with a discount, or what's called a contractual adjustment, and then you pay that contractual adjustment, not the contractual adjustment, you pay that remaining balance until you've hit your deductible. And then at that point, either one of two things will happen. Either your co-insurance will kick in, so the 80/20 split like I talked about, or whatever you've contracted with your insurance company, or in many cases, then they will take over payments. And then there's usually an out-of-pocket maximum for both in-network and out-of-network. And so your out-of-pocket maximum for in-network is usually much, much less than your out-of-pocket maximum for out-of-network, unless, of course, your insurance company does not contract under your insurance plan for out-of-network costs, in which case you will pay the whole bill. There will be no stopgaps. That's not a good idea. And so from there, once you hit that max out of pocket, even if you had, say, an 80/20 co-insurance, the insurance company will pick up the rest of that bill for that year. And how your year goes depends on your contract with your insurance. Sometimes that year can be a calendar year, so January to December. In many cases, though, it is based on the actual company that you get your insurance under when that year rate changes. So it could be like March, that's when they set up their insurance plan with that insurance company, then your year would start over every March. So that is just a quick summary on billing and insurances. I hope you've liked our discussion today. If you have any questions or comments, please comment below. If you've liked this discussion, please hit the like button. Thanks so much. Bye.